Welcome to Eco 103, Study Session 8, the Social Services Sector and the Nigerian Economy. Introduction. History does not know any country in the world that has attained development with neglect to a socio-economic service sector. The definition of a nation's wealth has indeed widened to accommodate not only physical capital but also human capital as an independent factor of production required to achieve high and sustainable economic growth rate. In recognition of this relationship, developing nations have, in varying degrees, attempted to stimulate the accumulation of human capital through public education expenditure as well as government spending on health and related social services. These services are indeed the strong foundation that must be laid before any meaningful socio-economic transformation of a country can take place. We will therefore explore the development in this sector in relation to the Nigerian economy. Learning outcomes. When you have studied this session, you should be able to highlight and discuss at least 3 social services rendered in Nigeria. Education subsector. It is a widely held view that no meaningful economic growth will take place in the absence of adequate human and natural resources. The concept of human capital refers to the abilities or skills of human resources of a country, while human capital formation refers to the process of acquiring and increasing the number of persons who have the skills, education, and experience that are critical for economic growth and development of a country. Okogie, 1995. Education is considered with the cultivation of the whole person, including intellectual, character, and psychomotor development. It is the human resources of any nation, rather than its physical capital and material resources, which ultimately determine the character and the pace of its economic and social development, according to Adebiyi 2003. Education occupies a central stage in the socio-economic transformation of any country. It is the supplier of trained manpower and prerequisite for the actualization of other developmental goals. Importance of education. The benefit of education in the development of any nation cannot be overemphasized. Education raises the standard of living of the people. It brings about improvement in the quality of health, facilitates access to quality paid jobs, enhances the productivity level of the entire nation, and also facilitates social and political participation of the people. The structure of education in Nigeria. Formal educational system in Nigeria. This system is categorized as: number 1, primary education; number 2, secondary education; number 3, tertiary education. The primary education. This is the first basic education received by any child in Nigeria. As revealed in needs, access to basic education is inhibited by gender issues. This is the first basic education in Nigeria. Formal educational system in Nigeria. This system is categorized as: number 1, primary education; number 2, secondary education; number 3, tertiary education. The primary education. This is the first basic education received by any child in Nigeria. As revealed in needs, access to basic education is inhibited by gender issues and socio-cultural beliefs and practices, among other factors. Primary school age in Nigeria is 6 to 11 years. The secondary education. In Nigeria, secondary education is divided into two sections, namely junior and senior secondary education. The age group found mostly in the secondary education are mostly between 12 to 18 years. In 2002, only 33% of this age group attended secondary school and only 4% joined the tertiary level, tertiary and higher education. The institutions of learning found under the tertiary education include colleges of education, universities, and other monotechnics. Nigeria regards higher education as essential for the development of high-quality manpower. University of Ibadan is an example of tertiary institution. Financing education in Nigeria. Despite the importance of educational institutions, Nigeria spends an almost insignificant proportion of our financial resources on education. In Nigeria, education expenditure as a proportion of GDP averaged 1% between 1986 and 1990, compared to 0.72% between 1990 and 1995. This performance fell below those of other developing countries, which in 1960 to 1977 were spending averages of 11.7 and 16.3% of their total expenditure on education respectively. The United Nations recommended that 26% of government budget be devoted to education. Seychelles committed 10.2% of its GNP to total education in 1985 to 87 and 7% in 1995 to 97. Ghana allocates an average of 20% of its total expenditure to education yearly. Between 1986 and 1992, Botswana spent 21% of its expenditure on education, Malaysia 19%, Kenya 20%, Uganda 15%, and Nigeria 3%, according to Olani and Adam 2003. Problems of the educational system in Nigeria. The educational system in Nigeria suffers from the following problems. Number one, inadequate funding. As it was highlighted in the last section, the budgeting allocation to education in Nigeria still remains low. 2. There are acute shortages of infrastructure and facilities at all levels. 3. There's a problem of gender issues and social-cultural beliefs and practices. 4. Inadequate attention to policy frameworks within the educational sector. 5. Low morale of teachers caused lack of basic. Number 5 again. Number 5. Low morale of teachers caused by lack of basic infrastructure, poor remuneration, late and irregular payment. 6. Non-periodic review of school curricula. 7. Lack of qualified staff, especially in the areas of science and technology. 8. Indiscipline on part of students and some teaching staff. Health subsector. Health can simply be defined as a state of being free from illness or injury, as well as enjoying complete physical, mental, and social well-being. According to Aboyade 1981, some improvement in health lead directly and immediately to improved economic performance. To him, investment in health are rewarded through time by streams of benefit from greater vitality and productivity at work, and by reduced absenteeism and longer working life. Levels of healthcare in Nigeria. As we have 3 tiers of government in Nigeria, so do we have 3 levels of healthcare, with each corresponding to a particular tier. These levels of health care are: 1. Primary health care, which corresponds to the local government. Primary health care basically emphasizes preventive Medicare, health clinics, dispensaries, and so on. Primary health care ensures the bringing of health care nearer to the people. Secondary health care. These basically exist to provide specialized services to patients, referred to it by the primary health care. The secondary health care is equally expected by law to provide administrative, training, and technical support and supervision to the lower level. An example of health institution that falls under this category is the general hospitals. Number 3, tertiary health care. Tertiary health care offers specialized health services and training. Special health institutions like the specialist hospitals such as orthopedic, special eye hospitals, etc. Teaching hospitals like the university teaching hospitals are under the category of tertiary health care. Health and economic development in Nigeria. There is a close connection between health and economic development. Whether it is good health that causes economic development or the other way around is not yet resolved amongst scholars. The relationship between health and economic development looks like that of hen and the egg. But one thing that is obvious is that a relationship exists. However, Aboyode 1981 asserts that subsisting in a strongly unhealthy environment is contaminant with chronic and sustained lung illnesses, which obviously limit the range and intensity of economic activity. Low outputs and incomes contribute to poor nutrition, which further enhances the rate of morbidity and mortality. It has been estimated that at least 10% of the normal activities of people in the underdeveloped countries are disturbed by illness directly. Requirements of the health sector in Nigeria. Here, we present the policy thrust of the health sectors as widely captured in needs. Number 1, improve its stewardship over policy formulation, health legislation, regulation, resource mobilization, coordination, monitoring, and evaluation. 2, strengthen the national health system and improve its management. 3, improve the availability and management of health resources. 4, reduce the disease burden attributable to priority diseases and problems including malaria, tuberculosis, HIV/AIDS, and reproductive health-related illnesses. 5, improve physical and financial access to good quality health services. 6, increase consumers' awareness of their health rights and obligations. 7, foster effective collaboration and partnership with all health actors. Problems of healthcare delivery in Nigeria. The following problems affect the health sector in Nigeria. Number 1, medical personnel are generally in short supply in Nigeria. Under the second National Development Plan, 1970 to 1974, the ratio of doctors to population was about 1 to 22,000. 2, inefficient management of existing hospitals and other health facilities. 3, poor data on the burden and socio-economic impact of diseases in Nigeria. 4. Policy inconsistencies. 5. Poor budget allocation to the health sector. 6. Lack of effective supervision of hospital staff, both the medical and non-medical. Power supply in Nigeria. In Nigeria, the history of power supply is mainly the history of the generation and consumption of electricity, which dates back to 1896 when the first power plant was installed at Marina in Lagos for residential consumption and street lighting around government quarters, according to Okmong 1987. Today, power supply has touched all the states in Nigeria. In 1950, the Electricity Corporation of Nigeria, ECN, was established to take over the generation, control, and distribution of electricity from the Nigerian Government Electricity Undertaking. The Niger Dams Authority, NDA, was created in 1962 for the development of the hydroelectrical potential of the river Niger and its tributary, the Kaduna River. The cooperation of NDA and ECN saw the construction of Kanjida. In 1972, the Electricity Corporation of Nigeria was merged with the Niger Dams Authority to form the National Electric Power Authority, NEPA. In 2003, the present-day Power Holding Company of Nigeria came on board. In Nigeria, the demand for electricity is higher than the supply. This has greatly affected economic progress and social well-being. The power system in Nigeria is unrealistic and unreliable and incapable of meeting the demand placed on it. Challenges mitigating against power supply in Nigeria. According to needs, the following faults underscore the neglect of the sector. Number 1, no new power plants were built between 1990 and 1999. Number 2, no major overhaul of plants were carried out between 1990 and 1999. Number 3, only 19 out of 79 generating units were in operation in 1999. Number 4, actual daily generation fell to less than 2,000 megawatts in 1999. Number 5, no transmission line have been built since 1987. Number 6, federal government funding to the sector decreased continually between 1980 and the year 2000. Water supply in Nigeria. Water supply in Nigeria is the responsibility of state governments. Virtually in all the states in Nigeria, water supply is the responsibility of the Ministry of Works. Most states have water boards for the production and distribution of water, mostly in the urban centers. However, Nigeria does not seem to realize the seriousness of our water resource problems. Ibadan, Lagos, and Kano, the largest urban centers in the country, have been having problems of water shortage for many years. Only very few towns in the Federation have organized water supply system, and in none is the system efficient in terms of regularity of supply, according to Okmong 1987. Water wells exist in some rural areas. A good number of these wells go dry during the dry season when their services are mostly desired. The Federal Office of Statistics 1999 Multi-Indicator Cluster Survey estimated that only 52% of urban dwellers and 39% of rural dwellers have access to potable water. Water shortage is one Water shortage is on the increase in the north. Major pollution is being experienced in the Delta area, and gully erosion is occurring in the southeast. Policy thrust for water resources in Nigeria. The key objectives of the water resources policy as presented in these include: 1. Ensuring the development and management of water resources in an integrated manner and as a national strategic resource. 2. Protecting water resources and the environment for balanced social and economic development. 3. Involving all stakeholders, particularly the private sector, in the sustainable development of water resources through coordinated management and holistic utilization. 4. Optimizing the use of water resources at all times for present generations to survive without compromising water supply for future generations. The success of government initiatives in social sector can be gauged from the fact that in the late 80s, all developing countries allocated an average of 4% of their GDP to public education and health expenditure. However, although this represents an improved performance on previous years, comparable data showed that during the same period, the average defense budget in the developing countries amounted to 6.5%, according to a World Bank report of 1992. Summary. In this study session, we have been able to show how essential the economic and social services sectors are in the development process of any country. We identify the challenges mitigating against these subsectors in Nigeria. The various explored subsectors are education, health, water, and the power sector. This is the end of study session 8. Thanks for listening.